recently I was able to catch up with Dr. Martin Rosen, who's been in practice for 30 years, just over 30 years, and we had a great conversation about pediatrics. And he's very involved with pediatric technique and training chiropractors protocols that are effective. So one of the things we touched on and brought us together was the topic of the new guidelines, which is regulating what's called quote unquote normal for child development. In other words, they've pushed back and delayed developmental changes because of the patterns that have become more prevalent in our children as of late, which is actually very destructive because it's not acknowledging where the actual problems are coming from. It's making developmental problems now normalized. So enjoy this interview. Thanks for listening. If you like the candid discussion and are seeking the truth behind the mainstream narrative, then please subscribe and share. Not only am I grateful, but those who seek the truth and wish to empower themselves and their family's health, freedoms, and future will also be grateful. I am here today with Dr. Martin Rosen. He is a practicing chiropractor. He's been involved in the ICPA and pediatric chiropractic for, I think he'll explain how long that's been. Right. But thanks for being here, Dr. Rosen. Appreciate it.
I appreciate it. Thanks for having me here. And I appreciate you taking your time and letting me share with your audience. I can give you a little history about how I got into it. So I was graduated school in 1981, chiropractic school, with my wife, Dr. Nancy Watson. And we have been teaching since 1979, 1980. I taught for, I do a lot of SOT, so I taught for SORCI, I taught for SOTA USA. I was the president of SOTA USA, president of the SORCI Research Board. So I've done a lot of teaching within my practice and taught for the ICPA, as you just said, for about 15 years. And during all that time, I also ran my own programs. I started in 1999 with a pediatric program that I developed for SOT. And I've taken that all the way to the point now where we have a certification program, a 46-hour, 3-seminar pediatric certification program. We also have an online company called Peak Potential Institute, which we run all our online programs for both adults and pediatrics, as well as we have our books there. We also have our hands-on seminars. So, like I said, I met my wife in 81 in chiropractic school. We got married. Went through, like everybody else, a lot of transitions in life. We have 2 children. One of them is a chiropractor. She graduated in 2013 from Life. My other daughter has been in the healthcare field, in and out of it. She lives in Colorado, my older daughter. And so we have done, like a lot of other people, journeyed through this, but chiropractic has always been our basis. That's how we raised our kids. That's how we brought up our life. Kind of similar to, like we were talking earlier, Wade, my first experience with that there has to be something else was when I was 17 years old, and I had dislocated my shoulder when I was wrestling, and went to my doctor, and he checked me out. I was in college at the time, came home, went to my doctor, goes, "Oh, it looks like you have some weak joints. You should probably give up sports." Mm-hmm. I figured at 17, hanging up the towel was not it. So there must be something else. And that's kind of how my path got into just finding about chiropractic. And how I got into pediatrics is simple. We had a baby and I needed to take care of it, understanding the philosophy of chiropractic, understanding about people's health potential. It made sense that I needed to have a skill set to be able to take care of my children as well as other children. And so I started to study that, develop techniques based on Dijonette's SOT protocols. And that's where we've been for the last 40 years.
That's awesome.
Yeah.
We get a lot of listeners. I'm basically in 24 to 25 countries right now. Awesome. So all of them are not chiropractors. In fact, the majority are not. Sure. So part of what I want to just reiterate for those listening is SOT and SORCI. Could you just break that down so patients, people know what to look for and why that technique protocol may be different than traditional?
Sure. So SOT is called sacral occipital technique, and it uses an indicator system to help make adjustments. So we have different protocols, and we use sometimes what they call blocking procedures. We also do cranial adjusting, and we can work with infants, newborns, or people who are 100 years old or athletes. It has a paradigm in where there are different types of adjusting protocols that will fit anybody's particular spine and needs. There are organizations that started. Sorcy was the Major DeJarnette was a chiropractic graduate of 1924, and he developed this technique. He was a researcher. He was an engineer, and then one organization was Saucy, and then there's another organization called Soda USA. They all teach his work. I've been involved in both of them to carry on his work. He died in 1992 at the age of 92. So we've been carrying on his work since that time through those organizations. And basically, the technique is designed to work with the entire spine, central nervous system. And one of its caveats that makes it somewhat different than a lot of other techniques is we do address the cranium and how to adjust the cranium, especially in the pediatric population when it's so important during those first 2 years of growth, and also in adults, with head injuries and just cranial distortion patterns. It's part of the SOT protocol that kind of somewhat separates it from a lot of other techniques that kind of stop at the spine. Not saying that that is not extremely important and powerful. It's just that that is where DeJarnette had found that accessing that other 80% of the nervous system made huge changes in people's health.
I, for one, think that's an awesome part about the cranial system, rather, is so movable, and yet it appears like, even anatomically, when I was back in the Gross lab, I mean, I was a prosector in the fascinating interlocking puzzle pieces that make it look like it doesn't move. Tell us more about that.
Sure. Actually, I'll do something. If we're going to do some video. So this is a baby's head. Okay, what's amazing about the baby's head, it doesn't come in colors, but what happens with the baby's head is you see all these soft spots. People are always used to feeling soft spots. Well, these soft spots and also the bones, they don't connect yet. There's a tissue called the dura, and the dura actually comes up and attaches all the way to the tailbone, comes all the way up the spine, attaches to each vertebral level, comes into the neck, and comes over the cranium, protects the brain, and then comes through these spaces and becomes part of the cranium. So think of it as a tension membrane that balances the nervous system. And the cranial bones in the first 2 years are really not good protectors of the brain. What they're there for is to allow the brain to grow. And the first 2 years, your brain grows 80 to 90% of its normal size. The cranium itself grows 2.5 to 3 times. In the first year of life, the brain actually increases in size 101%. So the whole job of this type of cranium is to allow for expansion. Then we get to the point, I'll get my friend over here, where we get what we call this sutural system, and what they're interlocking sutures. But even within the interlocking sutures, there's a certain amount of movement. Just like your ribs expand when you breathe, just like your spine goes up and down when you breathe, everything expands out. Well, your cranium actually moves what it's supposed to move when you breathe. And just like your spine can get fixations, the cranium has muscles around it and attachment points that, if those are not working right, can restrict that normal motion. And if that motion is restricted, it affects the movement of the cranial bones. It affects it on the tension on that system called the dura, which attaches to the spine and the nerves. So it attaches to the nerves and affects tension on the nerves. And the last thing that it does is it affects what we call cerebral spinal fluid. So you all know you have blood that goes through your whole body. Well, you also have a lymphatic system, which you know about, that cleans out, disease processes, infection, toxins. Well, in the cranium or the brain and the central nervous system, there's a lymphatic system, and that is called cerebral spinal fluid. So the neuromeningeal system has a space where cerebral spinal fluid flows, and that also works as a lymphatic system for the central nervous system. So just like if your lymph glands get swollen and you get sick, if the lymphatic system and central nervous system gets blocked or restricted, then your body absorbs toxins and you can get sick from that as well. So that's how that system works. It's an independent, though interrelated, secondary fluid system that also helps bring nutrients to the brain and spinal cord and remove toxins.
I love it. You just described something very relatable to the average person who could realize that there's a fluid within that system,
Right.
and that tentorium, basically that
Right.
that dura that actually comes in and translates as a really durable, like, piece of saran wrap, right?
Yeah.
That's mechanical. Can you tell us a little bit about the piezoelectric effect
Oh,
of that
okay.
CSF and
Yeah.
as well.
So piezoelectricity or piezoelectric effect is when a substance with a trabecular pattern or a crystalline surface gets compressed and it creates an electromagnetic field. So basically, how coal becomes a diamond is when it is under an immense amount of pressure for years and years and years, and it actually changes the structure and function of the coal and becomes a diamond. Well, piezoelectricity works with any what we call trabecular system, which are bones, which basically they're slightly honeycombed. Like bones are not completely solid. That's why when people get sick or get things like osteoporosis, the bones can crack and deteriorate because there's somewhat spaces in them. And so a piezoelectric effect is when you change the tension on a bone. For example, if I take my arm and I hold it bent in a position and lean it against the wall, if I do that for several years, the electromagnetic piezoelectric effect is going to create a change in the way the bones form, because the electricity or that electric effect determines how much calcium the body absorbs or the bones absorb. So it changes the amount of calcium, and it also changes how much calcium is destroyed, because your bones, just like the rest of your body, your skin, your hair, your nails, they change every 7 years or so. They reform. So the piezoelectric effect is an electromagnetic effect that occurs when there's either too much or too little tension on the bones, which can also be affected by the dura pulling on the attachment points to the bones, and that'll basically change the way the bones lay down calcium. It could also change the way they shape. So if there's too much tension, let's say, perfect example, when you look at kids, you talk about things like flagiocephaly or flathead syndrome, which is very common these days in the news. So if you think about that, what happens from that is that there is too much tension inside the cranium and the dura holding or pulling on the bone at one point, and that bone is not able to expand correctly. And therefore what happens is the brain will then push out to another end of the cranium because it has to grow, and that'll create the distortion. But at the same time, there's a piezoelectric effect, and the electromagnetic field affects the way the bones work, but it also affects the way nerves work, because nerves have kind of electromagnetic impulse. That's how they travel, almost like an electric field. And so if there's another aberrant electric field around them, it can also affect the way the nerves function as well. So it's a very powerful force, this piezoelectric effect, and it is caused by literally structural tension or changes in structural tension on the bony surfaces.
So thank you. That was well stated.
Right.
So given that information, let's transition towards, by the time, so first of all, people categorize chiropractic
Right.
in the mainstream
Right.
as a back or neck pain reason to
Right.
go to a chiropractor,
Right.
right? But what your approach is very, very different. It's
Yeah.
you're looking at structure, function, you're looking at physiology, and
Right.
your goal would be, correct me if I'm wrong, that is allowing the body to express a full degree of health or optimal health, which means you look at the things structurally before they're pathologic or disease state, even though many times they already are, but you
Right.
can make that impact. So with a child is what I'm getting to, setting that
Sure.
up. How does a parent who can't see, or kids don't complain of back, neck
Right.
pain, they're going to show it in some visceral things, but tell us how you start to translate a couple of the most obvious things you see every day in your practice with an infant or a child.
Okay. So over 40 years of practice, we have had timeframes where people have found, especially with infants, different issues that chiropractors seem to be able to help. So years and years ago, it was ear infections. Then at one point it became asthma, breathing issues. Then it became digestive issues. Then it became things like flagiocephaly, flathead syndrome, head distortion. Then it became nursing issues. Then it became tongue tie issues. So there's a whole plethora of issues. Then it became behavioral issues, kids on the spectrum, neurological issues, reading issues, learning issues. So what we're saying, and I want to get this clear because I know that a lot of your audience are in chiropractors and may not understand it. We're not saying we fix all these things or we treat all these disease processes, but when your child or yourself has an issue, a disease process, a functional issue, that is a warning sign that something underneath or something underlying that process is not working correctly. So in chiropractic, especially in pediatric chiropractic, we use our evaluation protocols to try and determine if the nervous system is functioning at its optimal potential. We want to look to see if there are indicators that show us that there is stress on the nervous system. And that can manifest in a variety of symptoms or almost no symptoms. So for parents, a lot of times they'll bring kids in and forget about all the issues we talked about, but if you have a child that doesn't turn their head as well to one side or another. You see that they don't like tummy time. They cry every time you put them in a car seat. When they're nursing, they like to nurse on one breast more than the other. Okay, you notice that sometimes their eyes aren't focusing. Or the other thing that's very important is they're not hitting their milestones. We have pre-programmed neurological milestones that we are supposed to develop over time, and they build on each other. You start by being able to lift your head. Then once you're able to lift your head, you eventually get to a seated position. Then you start to creep. Then you start to crawl. Then you start to walk. And all those developmental milestones are not only functional neurologically, but they also impact your social development, and they also impact your language and your sensory development. So they're all integrated. So if you have a child that's, 12 months old and still hasn't started to creep or crawl, that might be a problem. If you have a kid that every time that you try and put them on tummy time, they can't pick up their head, or if you have a child that doesn't roll over or can only roll over one way, these are all indicators that their basic neurological functions are being stressed. So we have all the disease processes, and then the last thing is distortion patterns. Sometimes, especially if parents have other kids, you'll see distortions like your child's jaw will only swing to one side, when they open and close their mouth, or one eye looks higher than the other, or it looks crooked, or one eye doesn't point. When they track or look, one eye doesn't move as smoothly as the other. It has vibrational. So these are all signs and symptoms that parents often see and sometimes don't get the proper care because they're often told, oh, don't worry about it, they'll grow out of it, or don't worry about it, it'll be normal. And the problem is that we are what called fault tolerant individuals. And if we have a problem, we will compensate for it. But the problem with that is, as we go along making compensations for these underlying problems, our threshold to adapt to stresses later in life becomes lower and lower and lower. Same thing if you think of a physical problem. If you hurt your knee, you compensate for it. Then if you hurt your hip, you compensate for it. Then if you hurt your shoulder, you compensate for it. And eventually what you have is a compensatory pattern where you can't function normally. One whole side of your body is not working. Well, the same thing happens to the nervous system. As each layer gets compensated, it decreases the threshold that's available for you to deal with stresses later in your life, which is often why kids will be diagnosed at age 3 or 4 or 5 with neurological issues that actually occurred or underlying within the first 18 months of life. And that's what our job is as chiropractors or pediatric chiropractors, is to help to clear out that nervous system, make sure it's functioning well so that symptoms often don't occur. I mean, we're not looking only for symptoms. We want to make sure that the child is healthier. And just like you go to your dentist to have your teeth cleaned and then to check out your teeth, you should bring your child to a chiropractor to have their spine checked to make sure that they're functioning correctly and that it's okay. And that's kind of what we try and teach our parents, is to get your child checked regardless of the symptoms. And if there are issues, then give us a chance to basically see if the underlying neurology is part of that causative factor.
And kids respond brilliantly to
Oh,
chiropractic.
oh, amazing, amazing. They're my favorite. They're my favorite.
So there's a couple things I don't want to overlook there and
Okay.
overstep. They're major distinctions, and there's a problem. Now, when Dr. Rosen and I get together and we talk,
Right.
there's a lot of things that are already already foundational. I don't want to say belief sets, because they're more knowledge based on understanding. For example, the 33 principles of chiropractic, rather, that are just part of our understanding, which means we're already rapping about stuff. But when we talk about society understanding what you just said,
Right.
many are stuck in a survival mode. They're struggling with survival. They don't think of thrival. When we're talking about catching
Right.
something to prevent and be proactive, there is a portion of the population that, because they've empowered their doctor to make that decision medically,
Right.
that nothing is wrong, therefore their faith in they will grow out of it, and the denial that there's anything going on beyond
Right.
is this where I feel the challenge, where the rubber meets the road, right? It's like,
Absolutely.
how do we help people understand? And what you said was very clear, but it can't be overlooked. Some will resonate right with exactly what you said and go, that's extremely logical. And the
Right.
next person will go, but I don't see anything wrong, and my doctor says it's not necessary. There,
Right.
and by the way, the antibiotics cleared up his ear infection, and he
Exactly.
just had his shots, and that's just normal to have him, breathe funny after he's been vaccinated.
Right. So, there, you're right. We're talking about two different paradigms, but parents, and we know that very often, especially moms, have an intuitive sense when there's something wrong. And they really need to learn to start to trust that. So, I mean, a perfect example, here's a very blatant example. I had a patient brought into me, little baby, and the reason the mom came to me is because her child, and this is a true story, I'm not making this up at all, the child had not had a normal bowel movement for 20 days. And they went to the pediatrician 3 times. And even after the third time, the pediatrician said, "Don't worry about it. Let's try some more Miralax or whatever." And he said, "It's okay." And finally, the mom intuitively went, "No, it's not okay to not have a normal bowel movement for 20 days." So when pediatricians or other people tell you, "Oh, don't worry about it," we just wrote a book, my wife and I, call It's All in the Head. And the premise of the book is to not accept things that are common as normal. So just because a lot of people have these problems or a lot of people have these issues doesn't make it normal. You said, you talked about the immune system a minute ago when you talked about, vaccinations and disease processes. It's just because people have a weird reaction when some toxins are put in their body and that they get a fever and they get sick and they have other symptoms around it. And because a lot of people have it, doesn't make it right. It's just common to have that, but it's just not what we call normal. So you really have to be careful when, especially as a parent, when you know that there's something going on, especially that you feel is an issue, but the pediatrician says, just wait, let's wait and see. And the reason wait and see is such a bad approach is because, as I said really earlier, in the first 2 years of life, 80 to 90% of your nervous system is being developed. That means what we call the gray and white matter, which are the types of matter that run the nervous system. White matter is the pathways, and the gray matter is the stuff that sends all the messages. And so in the first 2 years, you're laying down 80 to 90% of that. So you don't want to take those 2 years as inconsequential. You don't want to say, "Oh, let's see what happens," because if you wait till 3, 4, 5, or 6, it may be too late to recoup the damage that was already there. So comment
That is a key point.
Yeah,
That windows do close in a child's development. It
absolutely.
reminds me back to Joseph Chilton Pierce's book. Do you remember that
Sure. Oh my
one?
God, yeah.
Awesome book years ago.
I saw him
Um,
speak a number of years ago at the ICPA, actually. But yeah, go
that
ahead.
is
I'm sorry.
awesome.
Go
I
ahead.
am just, by the way, I'm scrolling trying to find some posts that I also put up a while back that you're aware of, but I
Yeah.
wanted to move right into what you're talking about with how the societal acceptance of a condition is now being normalized. And I have a
Yeah.
real problem with this from a standpoint of what this says in the message it
Oh
gives to
yeah.
parents and our kids, that we're just going to accept this less than healthy. Here it is. So when we talk about developmental milestones, so I
Right.
apologize for the slight distraction there, but I just had to find this. I wasn't
Right.
reading texts. Um, so when I ask you this, I want you to just share how destructive this is, but what you would notice in practice as an example. So developmental milestones by the CDC, 2000, this is from February, I believe, 8th,
Right.
2022.
Right.
Okay. They have changed the criterion and the milestones as a
Right.
result of commonality.
Yep.
Crawling is no longer a milestone.
Right.
Walking changed from 12 months to 18 months.
Right.
Talking changed from 12 months to 15 months. What does this mean?
So a little bit, I just want to change one thing on that. There was they did change talk. What they actually did is decrease the number of words. Okay, so they basically said that by age 2, you only need to know 50 words.
That's right.
Before that, you needed to know 250. So what they're saying is, so we've had a rough couple of years, right? We've had COVID,
Mm-hmm.
and kids have been abnormally shut down. Maybe they've been masked. There's been a lot of issues with speech and developmental issues, and kids are not getting the stimulation. Your nervous system develops by stimulation. You reduce stimulation, you reduce the ability of the nervous system to grow. And it grows by making connections. Those connections are called synapses, and that happens when you get stimulated. So what's happening is we now have a generation of kids whose level of stimulation has been decreased because of external factors, not because of choices that parents mostly made. They've been kept home. They haven't been able to go to school. They've been having not to be able to interrelate with their peers. So that has really affected their development. And so what you're seeing is a change in those development. You're seeing a decrease in their developmental abilities. So instead of saying, "Oh, we need to fix this," or "Why did this happen?" or "Let's make sure this never happens again," we're saying, "Let's just accept it." I have 2 perfect examples of that. When I went to chiropractic school, the autism rate in the United States was 1 in 2,500. It is now 1 in 42. And people just go, oh. And the Health and Human Services came out, I think it was in 2019, and they said
Mm-hmm.
that, check this out, 54% of our children have chronic diseases.
What's the most cost-effective, most affordable, and portable way to get into infrared sauna technology? Therasage360.com. Use code FSDW360 for your discount today. Delivering results that last.
That's more than and where that's so that's what Jack, what you're talking about, accepting, just keep lowering. Like, would you lower the bar for your children's life and your children's health? Let's take a perfect example, athletes, right? I don't know if you watch the Olympics. I'm kind of into watching them, and I just like athleticism. It's amazing. So if we watch the Olympics and every year people got slower, jumped not as high, couldn't do, if the world records kept getting worse and worse and worse, would we be going, oh, that's cool, we'll just accept that? Just take it now. You don't have to worry about a 4-minute mile. Now people could do a 5-minute mile. It's like we can't keep accepting these dysfunctions as normal. And so children's health, children's functional capacity, taking crawling out of the mix is like telling you that you don't have to integrate your nervous system. Like, don't worry about it. It'll figure it out. Creeping and crawling integrates the entire nervous system. It helps the right and left brain speak to each other. It helps with gross, fine motor movement. It helps with coordination. It helps with behavior. You can't unlink functional capacities with social emotional capacities. It's all linked into one nervous system. So if there's a functional capacity on one level, it's going to happen through all layers of this child's life. So instead of taking things and watching those numbers decrease and just accepting them and trying to treat the disease process, what we need to do is find out what is the underlying cause of it. Is it toxicity in our environment? Is it a toxicity in our food? Is it toxicity that we're putting into our children's bodies? Is it the way where the pregnancy is going? Is it the way the birth process is being treated as a disease process? There are so many. Is it the water? Is it the air? We need to look at these things. Is it their nervous system that is being stressed and not adapting as well? That's where the chiropractic venue is. The nervous system gets stressed physically, emotionally, right, chemically, and spiritually. There are factors. That's how you deal with everything in your body, is your nervous system. So if there are higher levels of stress, the nervous system has a higher propensity to break down, and it also needs a stronger foundation. And so what chiropractic care does is it offers the nervous system a stronger foundation, a greater threshold to adapt regardless of the stressful environment. And then we need to deal with what that stressful environment is once we have taken the baseline and made a stronger functioning human being, as opposed to accepting them being less and less and less.
Yeah, that's what I love most about the work we get to do,
Right.
is that a patient might come in for one reason and they realize that they're getting help in all these other areas. Are we
Absolutely.
fixing them? No, we're actually restoring balance to the body, and the body's unwinding and peeling back and moving forward in its integration. So therefore, you increase the margin of error regardless of where this is coming from. It doesn't make bad water or bad environment go away, but it increases your ability to adapt to that environment. I love the way you said it.
Well, how many times have you had this happen to you? I'm sure, doc, that patient came in for whatever symptom, whatever issue they came in for, and then all of a sudden these other things started going away. They said, "Hey, you think you could be chiropractic? Like, I don't get headaches anymore. I'm not. I don't feel." I have a woman that said, because she came in for some lower back issues. She goes, "I don't get angry when I got used to anymore." She goes, "I can't believe this. I was just talking to my daughter, and I just feel a sense of calm." Said, and it started since I started seeing him. Saying, yeah, your nervous system is moderating itself. Yeah, so you're not on that stress. You talked about that, the fight or flight stage. Yeah, we're so tuned into fight or flight in our nervous system, and chiropractors have an ability to help flip that switch to kind of calm that fight or flight system down. And the other thing about fight or flight state is you can't heal in a fight or flight state. You can't. There's not enough energy left to do that. So you have to get out of that fight or flight state to be able to heal. And that's part of what we do.
So I want to shed a little light on that, just with your knowledge. So you got a patient that has anxiety and depression, which
Right.
is a form of autonomic overdrive
Right.
exhaustion, which is fight
Right.
or flight or
Sure.
sympathetic dominance, right?
Right.
So let's look at what manifests structurally and cranial with your knowledge with a body that is under anxiety, either through perception
Sure.
and then creating a manifestation structurally,
Right.
and or structurally being off and now stressed by the littlest thing. You just
Right.
alluded to it in another angle. Go ahead.
Well, that's the great thing. So SOT, the words SOT stand for sacral occipital technique. So sacrum is your tailbone, and the occiput is the bone in the back of your head. And the reason that it's so amazing about what you talked about is, so there's two parts to your nervous system: your autonomic nervous system, what you call your automatic nervous system. There is your sympathetic and your parasympathetic. The sympathetic is the fight or flight system. That's what we were just talking about, and that's located in the spine. From the upper thoracics to the lumbar spine, there are nerves there that fire that sympathetic system, right? And it keeps you in that fight or flight state, or allows you to function. On the other side of that coin is what's called the parasympathetic nervous system, and that is what they also call the rest and digest system, or it's the calmative system. It's a system that shuts things down so that your body can actually heal, can digest food, can form certain metabolic functions, and it is located in two places: your tailbone and your head. That is your cranium. So you have your tailbone and your head control the parasympathetic, and then the rest of it is your sympathetic. So if you think, two things happen with the sympathetic fight or flight system: either the sympathetic system gets charged up, gets too hypersensitive, and keeps firing, 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 and the parasympathetic system can't kick in, and it's like a switch that you can't turn off, and it can't flip the switch because there's so much stimulus, so that system just gets discharged. And two things happen: the sympathetic system, as you said, once you get into that fight or flight state, will show a lot of tension. So people come in, they're really tense. Their back will be tight. Their shoulders will be really tight. Their neck will be really tight. They'll create a constant tension. They'll have, decreased ranges of motion. And what happens in that state is they stay in that state for as long as possible. But over a period of time, what will also happen is then those muscles, because they're so tense that those will fatigue, and the system will break down. And it'll be the person that all of a sudden lifts a grocery bag out of the car for the first, and all of a sudden cripples themselves. They end up on the floor because they can't move. Is because their musculoskeletal system has just failed. It's just so tight and wound up. So you'll see a lot of that. The parasympathetic system, when there's distortion, especially in the lower back and tailbone, gets affected because then the nerves in the parasympathetic system can't fire correctly. So again, you'll see a lot of tension, a lot of tightness, a lot of pain. Usually, what we see in our society are sympathetic dominant disease patterns. They're in a fight or flight state. Parasympathetic disease patterns are often more chronic. So things like what we call chronic fatigue syndrome, and all those diseases, it's when the sympathetic system has basically died. It's just shut down. It's gone. The glandular system can't work. It doesn't function anymore. And so the system is a very low tone system. These people become very lethargic. They will become depressed, right? Because again, they're not getting the proper hormones to their brain. Functions will start to shut down. They'll have, digestive issues will be very common with that. They can't digest food. They'll have severe allergies to things because they can't break down the protein. So it becomes an imbalance in that autonomic nervous system. And if you don't restore that balance, you can treat the symptoms all you want, but you're not going to correct the underlying issue. Very common with long-term parasympathetic diseases are the fact that you're on medication for the rest of your life, right? If you get diabetes, right, it's like, oh, you don't cure the diabetes, they give you insulin. If you have high cholesterol and a propensity to heart disease, they don't tend not to cure the cause of it. They'll give you statins. I mean, the list is endless. How, medicine will see a disease process, and opposed to trying to reverse it and get to the underlying issue, we'll just basically supplement it with something that the body can't make anymore. And once you supplement that long enough, the body literally can't make it anymore, and you're hooked for the rest of your life on whatever that particular drug or process is, because the system can't restore itself.
Yeah, brilliant. I love the way you put it. The connection with parasympathetic and sympathetic, the inability to let the engine RPMs down at night is an example. And over these last 2 years, like you'd stated, this chronic state that we keep people in, one of the things that I see tremendously is the inflammatory response in the body as a result of, and we can point to many different avenues, and we do as providers address causative things upstream in different ways to get at it.
Sure.
Like technically we make sure that the structure in the body is like balancing, so there's energy, like you said, to
Right.
adapt and provide life
Right.
force to these systems. And yet that patient goes back and swims in what we call the cortisol bath,
Uh-huh.
which is literally the life that they're in pulls them back. If it's news they're watching, if
Right.
it's something they're buying into, then they're pulled into a stressful environment and wonder why they can't digest food, which means,
Right.
in my eyes, I see that downstream inflammatory response in the body, leaky gut, fibromyalgia, you name it, chronic fatigue, hypoadrenia.
Right.
I mean, thyroid, we're talking about the same things. Their hormones are off. And it's like, wait. And so the drug comes in as the quick fix.
Right.
And we're trying to stop the patient for a second, breathe, say, all right, let's assess where your challenges are coming from, get towards the cause of that, open that up, and give the body a chance. And you said something in there that there is a point where the chronic stress does damage, and
Right.
leaves an absolute permanent mark. The body's still amazingly, I'm just going to give you two examples.
Sure.
Guy comes in, 7 surgeries, 3 in his low back, 4 in his neck, discectomies,
Right.
laminectomies. Wife makes him come in. He doesn't even want to be there. Drove an hour and 15 minutes to get to my office. Why am I even here? And I said, I don't know. You don't have to be here.
Right.
My wife made me, but as long as I'm here, do something. So he had been on PPIs, proton pump
Yep.
inhibitors, antacids for those listeners, for 22 or 25 years, something right around there, but over 20 years. I'm like, I don't know what I can do to help this guy.
Right.
Well, one of the things where I have a lot of work done and still am fascinated with is, metabolically speaking, with my scenario that drew me into, with my recent past history with thyroid and heavy metals, is that there was a lot of linear mindset, even with me chiropractically, where I was eating healthy, I was living my life. My weight is,
Yeah.
I was anywhere from 8 to 12, 13% body fat. My waist size hadn't changed, blah, blah, blah. And so I got adjusted regularly. We do these things, right? And we're like, okay, I'm healthy. And yet this was happening below the surface subclinically. I didn't have symptoms of my thyroid,
Right.
but my body was stressed. Coming back to this gentleman, we know that if we're not digesting protein, and that's what proton pump inhibitors do, is they stop the acid that allows us to then digest and release pepsin, but then digest protein. You're depriving your musculoskeletal system and
Absolutely.
integrity of protein. And this is a lot of Loomis's work, Dr. Howard Loomis. But the point for mentioning that is, when we come back to this, there was a level of damage. And aren't you fascinated, Dr. Rosen, which I'll let you
Right.
elaborate on, with some shares with your patients, with how fascinating this guy is, golfing 3 days a week, and he's awesome. I
Right.
mean, he did have a response once he got vaccinated. Everything showed back up again,
Right.
and we had a talk.
Right.
And again, I'm not anti-vax. I'm pro that patient. I'm
Right.
pro-choice. I'm pro-informed consent. So when he realized what had happened, re-inflaming everything,
Right.
and now we're back on the path again where we clean that up. But it's not always the case where we can clean it up. That's part
Right.
of my mentioning it. But I'm still surprised at how much damage the body can take and still turn things around, which is just bizarre, isn't it?
Oh, it's amazing. It's amazing. You talk about surgery case like that. Yeah, I've had that one. I was gonna try and give a scenario. So when nerves first get irritated, they get hyperexcited. So, for example, a patient comes into your office, if you're a doc, and they come in with, neck, shoulder, and arm pain. It's radiating down their arm. And then another patient comes in and they can't feel their arm and their hand is numb and they can't lift it. There are two types of nerve damage there. Which one is easier to treat? Obviously, the acute nerve damage, where the nerve is still functioning, hyperexcited, is much easier to treat than the nerve that's already been damaged and dead. And that happens to all nerves. So in the spine and in the organ system, there are what we call viscerosomatic reflex arcs, which basically are nerves that go to the organs back to the spine to moderate how the organ is functioning and to help give it a proper nerve supply and increase blood flow and all that stuff to it. That's a chain. That's a cyclical chain. And if it's too excited, then you can create hyperexcited organ system function. So you can create too much stomach acid, right? There's one way that you can do it. Your adrenals can be too fired up, so you can't sleep at night, right? And the other thing can happen is you can create decreased function. So, for example, your liver, if it doesn't get a proper nerve supply, proper blood supply, can't function. It has about 6,000 different functions. It doesn't filter toxicity. So your system gets toxic. Same thing with your kidneys. And any inflammatory response then stresses that system. So if you have certain low functioning organs that are elimination organs, like kidneys, let's say, and the liver that we just talked about, and large intestines, anytime there is an insult to that system, an outside toxin that the body can't, because those systems are already low functioning, can't get rid of again, the toxins get reabsorbed back in the system, which is exactly what you just said happened to your patient. They're doing well. They still had a toxic load that they're dealing with for the last 20 or so years, but you had helped their body lower the threshold by making an adjustment. And then when you put something in, whether it be a vaccine or a drug or anything that pushes that threshold back up, the whole cycle can start again, because it is a pathway that the body already knows and has already used. So the longer you can stay healthy, the longer you can keep your system below the thresholds and keep lowering that threshold, the greater you can adapt to stress. And one of the things I wanted to talk about and mention, which you talk about the flight or flight state, is that in the last 2 years, people have been inundated with fear. And fear is one of the strongest mitigators for fight or flight, because that's what the whole fight or flight system is about. It's about if you see a danger and you have to react to that danger, then you get in this fight or flight state and you either attack or run or whatever it is to save your life. So fear, that's what fear does. So if you're in a fear state, you're basically in this fight or flight state which doesn't shut off, and the system will break down. It's like if you're running from a tiger, right? Because you're in a fight or flight state, at a certain point you're going to collapse if you can't get away from that tiger. And that's the same thing that happens when you're in a constant fear state. And you keep running, trying to stay away from this disease, or stay away from that, or stay in my house, or stay away from people, or put this on, or wear this mask, or whatever it is. And you're constantly afraid to do anything. Eventually your system's going to break down, because you can't live like that. And so that,
Yep.
yeah, so that's kind of what, this is the whole thing we're talking about. As far as patients, I mean, we've all had millions and millions and millions and millions of chiropractors, I mean, chiropractic patients have had miracles in their offices. I've had stuff go away with people. I had kids come into me that were gone to Children's Hospital in Boston, and they were under care for a year and a half there. And the kids were basically giving a diagnosis of failure to thrive. And they were, 3 years old and weighed 35 pounds and couldn't digest food and had MRIs and all this stuff. And that was the diagnosis, failure to thrive. And we started adjusting them. And, 1 month later, they're starting to gain weight. 2 months later, they're gaining weight. 3 months, they're back on the, their right trajectory, and all their symptoms are gone. They're eating. And that kind of stuff happens all the time.
Every day.
Every
day. Yesterday, I'm adjusting a not even 2 months, maybe close to 2-month-old, and was not a natural childbirth, number one. I've seen this mom before and through the whole pregnancy. She had some of her own current health issues she was dealing with, but this was her second child. And the first one was, now she equates back, wasn't under chiropractic during that one, so she sees a stark difference, right?
Right.
And awesomely educated mom, very from a holistic mindset. And yet there's these challenges with this beautiful, perfect little infant.
Right.
And his head shape was pretty darn good, but we saw some variation, and I do cranial work as well. And from being jaundiced right away, and I saw this baby right after birth, like within the first 24 to 48 hours, and he was jaundiced, and that jaundice went down. And over the years, sometimes it's gone in minutes when we adjust, and other times it's a little slower to respond. But back again to the context of her history with the previous child, then there's some issues with the mom in that area. So I'm like, okay, that makes some sense. Let's just keep at this. But we're now in 2 months. He was not suckling well, and you know what that's all about. He wasn't able to latch. So then it was tongue tied, and I'm like, whoa, this is part of the whole, autonomic nervous system and his ability to coordinate movement. And he's got some issues, upper cervical, of course, as well as cranial. But the beautiful thing is, I just got a great text again after we adjust. The bowels move like magic. Boom, just like that. Digestion, less spitting up. I mean, and I'm not treating, as you know, any of these things, but the body it's connected to the performance and the ability to adapt and grow that this child has. And it's so crucial at this, like you said, the window, 101% in the first year.
First year of life, 101%. 15% in the second year. Yeah, it's amazing. The period of time where your nervous system is making the most connections, like the fastest speed of all the connections creating the roadways, is within the first 8 months of life. That is the peak potential for synaptic development. Now, it doesn't say we obviously create them throughout our lives, but at different speeds. So yeah, it's an incredible process, and you never know what will happen when you make an adjustment and what it will change in that child's nervous system and what their actual potential is until you start to do that, until you start to make those changes. One of the saddest things I saw was I had this little boy. So I had this patient of mine. She was a lawyer, and she used to foster care kids who were very damaged. Either they were, born drug addicted or whatever their issues were. And one day she brought this kid to me that had cerebral palsy. He was 3 years old. He was in a dysfunctional family, and they finally got him out. And they never had him do anything but lie on. He could not do anything at 3 years, but lie on his belly or his back, wherever you put him. He could not move. And it's horrific. And so she brought me, said, "Can you do anything, Dr. Rosen?" And she had special dispensation from the courts to be able to bring these foster kids to me for care because they weren't really her kids yet. She hadn't adopted them. And she used to bring she brought all kinds of kids. But this one in particular was just so sad. He was a beautiful little boy, kind of blonde hair, blue eye, and he couldn't move. And anyhow, we started adjusting him, and he was within 4 weeks, he was able to pick his head up. All right, he started to smile. You could put him on his back, and he would try to sit himself up. He could start to try and roll over, and we could just watch this kid just start to develop. And the sad part was we were working with him for a little over 3 months, and the parents petitioned the court to get him back, and they ended up giving him back to it, so we didn't get to see him anymore. But even within 3 months, he was like a different child. He was able to lift his head, smile. So yeah, these are the kind of things we see in our practice, and these are the kind of, we miracle stories are great, but the whole idea of what we do is to really be able to make generations and generations and generations of children be able to function at a better level, at a higher level. And so you may have a kid that has no symptoms and gets under chiropractic care and gets under regular care, and they just do their life. And that's really okay. That's really, that's fine. We're not looking, we don't want every sick kid in the world to be only people that we see. We want healthy kids to be able to stay healthy. And who knows what potential their nervous system then has when it's functioning clearly.
When it comes to infrared sauna, the technology at Therasage360.com is on the forefront of delivering results safely and effectively. The technology in Therasage 360 is not only affordable and portable, it allows you to access the benefits of infrared technology on any budget. For a 15% discount on all products on Therasage360.com, use code FSDW360. You'll be glad you did. I won't go deep onto this, but real quick, you've been in practice so long and you've seen changes in the profession, and I've been aware
Right.
Of the AMA's role in trying to exterminate chiropractic.
Yes,
In fact, the
right.
book that Contain and Eliminate,
Right.
I have a desire to make sure young chiropractors become aware of this history.
Huh.
But you've seen changes in referral, medical acceptance of the profession in many ways, and yet there's still some very dinosauric approaches yet. What do you think the biggest challenge is to, you getting referrals MDs wise? Why would that be? And I get some,
Yeah,
but
some too,
it's nowhere near what should really be happening. Why do you, in your opinion, why do you see that?
So it's a paradigm shift. A number of years ago, I was asked to speak at Children's Hospital in Boston, and one of my friends, who was the president of the Masters of Chiropractic Society, and he said, I want to come. I'll talk a little about chiropractic, but it's Children's Hospital. I want you to do the pediatric part. Will you come? And there were 15 physicians and physician's assistants. And what we did is basically give them a lay lecture, a lecture on what chiropractic was. And in the beginning, all of them were sitting there like this. And those you know body language, this is not the greatest way you want to see a crowd. And by the time we were done, they were talking and they were, opening up, and we were listening. They were talking, and then they started asking questions. So one of them said to me, he said, "So how do I know what children I should refer to you for care. Because now we're talking about disease states here, because they're children's hospital. They're not talking about. And I said, well, unless they're bleeding, this is what I said to him. And this is, I wasn't trying to be facetious. I was trying to make him aware of the paradigm. I said, look, unless they're bleeding out and need emergency care, whatever their sickness, disease issue is, send them to me first. I will start to adjust them and clear out their nervous system. And if they don't get well, then I'll send them back to you, and then you can treat them for the disease process, because that's really what the paradigm is about. It's about giving the body a chance to heal. And so physicians can't see that, and it's not their fault if they're not trained that way. It's just like you and I probably will have different opinions about certain things, or even as simple things as a baseball team. I live in Boston. I like the Yankees, so I get a lot of guff for that, right? But it's not. It's a paradigm shift that people have to be willing to take and accept. So there's accepting the paradigm. It's trusting the other person. That's the other thing. Chiropractors really have to stop shooting themselves in the foot, and be really stick to the science of what we do, which has been written in literature for years and years and years. There's no
Very well documented.
Yeah, there's no doubt. It's like, 2015, the medical profession said, wow, we just discovered that cerebral spinal fluid is the lymphatic system of the central nervous system. I'm like, what are you talking about? We've been telling you that for 35 years. And I actually pulled up an article that wrote it in 1972. So there's communication, there's acceptance, and in our end too, there's acceptance of, if we can shift the paradigm. I had a physician, a medical doctor, that used to refer kids to me all the time for ear infections. And she only referred that, and I found out because another one of my patients who had seen her had a kid with bilateral ear infections, and she never referred the kid to me. And so I decided, what the heck, I'm going to call her. And I called her up and I said, hi, this is Dr. Early. She said, hi, how you doing? I said, I just want to thank you for all your referrals, over the last couple of years. I said, but I'm curious, why do you refer kids to me with, how do you determine who to refer to me with ear infections? That's who she referred. I said, well, if I have a kid that has chronic ear infections and it's only on one ear, one side of the body, I'm assuming that's structural. But if it's on both sides or it switches around, then I think it's something that I should treat. And I'm like, I don't get that, but I also don't want to, cut my bridges here, burn my bridges here, because and I just tried to explain. I said, no, it's not that. It's just structural. I said, it's also about their immune system, that we help to facilitate the function of their immune system by making the adjustments. So it doesn't matter if it's the right ear, left ear, or both ears. And we still had a very, pleasant relationship. She still referred, kids to me, but still most of the time, kids with, ear infections on one ear that kept coming back.
Mm-hmm.
So I think that's it. But we need to keep the communication open, and we need to be accepting of the fact that while chiropractic is a science, for you and I talking about our history of it, it's also a belief system in a paradigm of health that not everybody holds. Right? I'm not from New England, but when I move here, it's like, well, don't fix it if it's not broken. So maintenance care was a really hard thing to talk to people about. It's like, no, I get it's not broken, but it's going to break. So we need to take a look at it. So I think that's it. And our profession, part of it is on us. Our profession really needs to put out a congruent message. And even if you don't treat, like I know a lot of chiropractors who don't treat or just kids, that's fine. Then you refer to people who do. It doesn't mean that the paradigm of adjusting kids is wrong. It means that you don't have that skill set or want to do it. It would be like an orthopedic surgeon saying, oh, I don't believe in pediatricians. I don't think kids should get, checked by it. So it's no different than that. We need to basically be congruent in our message, congruent with us, accepting of it, but also don't ever be afraid to speak the truth. And that's the other piece. Tell the truth about what we do. Because if they're not going to accept it, they're not going to accept it. We know what we do. We've seen the miracles. Or you've seen, what you say, 28 years in practice. So between the two of us, we got 68 years in practice, and I'm assuming we've seen hundreds of thousands of kids between the two of
Yep.
us.
Yeah, then we add our wives into the equation,
Right.
both chiropractors
Oh, your
as
wife's a
well, right?
chiropractor too? Okay, mine is also. Yeah, so right.
Yep.
Yeah, so
So there's 80 and 56 here.
yeah. 136 years of clinical practice. I think
Yeah.
it's probably worth it, Yeah. So I think that that's an important factor. And I still, sometimes patients will say, well, my doctor said that I shouldn't bring my kid to a chiropractor. And what I tell the patient, I say, why don't you ask your doctor what I do? And she goes, what do you mean? She goes, well, they don't know what I do. I said, they think if they're on YouTube watching people get their necks twisted and pop. I said, we don't do that. I said, ask your doctor, if he says it's dangerous to treat a kid, ask him what I do.
Mm-hmm. He's lumped you into the category of what
I'm not taking a
mechanistic
2-month-old and twisting their head till I hear this wicked popping noise that I can put on YouTube. There are specific techniques for the pediatric practice. And that's
Correct.
So that's one of the things I always ask them, or ask them why, throw the question back to them, like, why are you saying this? Well, it's dangerous. No, it's not. Chiropractic care for pediatrics is safer than it is for adults, actually, depending on the technique you use, right? Because you're using little pressure. So that's not the case. It's not safe, So none of the, usually if you check the boxes off, none of them are rational. They're just their belief system or their bias.
Right. Well, I certainly appreciated our chat, Dr. Rosen. How can people find you?
All right. So a few things. One, I'm going to put up my little book here. This is for chiropractors and lay people. It's called It's All in the Head. All right. And it is a book, like I said, talks about structural functional distortion patterns and how they affect the nervous system and what parents could be looking for to determine if their kids have issues and where they can go for help. And you can get that and all of our stuff at peakpotentialprogram.com. That is where all our classes are and all our online stuff. If you want to contact us, the best way probably is at my email at drdrmartinrosen@gmail.com. That is it. The other book we have also for chiropractors is this one. It is our Pediatric Chiropractic Care book, and it is a technique book. It is for chiropractors. It has complete pediatric spinal and cranial exams plus adjusting protocols. There's over 200 pages, illustrations and stuff. Some people use it as basically their kind of technique Bible, I've been told. So it's a great technique for SOT as well as other practitioners. And the last place to contact us, if you are someone interested in some of our lay information, if you're a patient, then you can contact us at Wellesley, WELLESLEY, Chiro.com. That is our office website, and all the information is there. But we'll be happy to answer your questions, connect you with pediatric practitioners. We have a whole bunch of certified pediatric practitioners that are on our website that have taken our classes, and we'll help you. We also connected, as you mentioned, to the ICPA, and we'll help you if you need to find a pediatric chiropractor in your area. We'll try and help you do that as well. So thanks again for your time. I really appreciate it. This was great talking to you, and I appreciate you taking time and letting me share with your audience.
You betcha. And it was a pleasure actually getting a chance to meet you after seeing some things online. I've seen your stuff online for quite some, I don't know, I over the years, I would say. And so all your information will be in the show notes as well, folks.
Great.
So if you didn't get it, it's going to be when you click on the link in terms of the podcast, it'll be in the show notes. So thank you, Dr. Rosen.
Thank you.
It was my pleasure. And I will see you again, my friend.
All right. Thanks a lot.
All right. Ciao.
Ciao.
Okay, my fellow health warriors, it's time to head over to iTunes, franklyspeakingdrwade.com. There, you can rate, review, and subscribe, as well as share, so more of our brothers and sisters can grow to realize their voice and their health freedom. Speaking up means you matter, so get on it. This podcast is for information purposes only. The statements or views expressed are not medical advice and are not meant to replace the advice of your medical doctor. This podcast, including Dr. Wade Anderson and his guests, disclaim responsibility for any adverse effects you may experience from the specific use of information contained herein. Opinions of guests are their own, and this podcast does not endorse and accept responsibility for statements made by guests. This podcast does not make any representations or warranties about the guest qualifications or credibility. This podcast may contain paid endorsements and advertisements for such services or products. Individuals on this podcast may have direct or indirect financial interest in products or services referred to herein. If you think you have a medical condition, consult your licensed physician.